Cut across live to an address by Finance Minister Arun Jaitley at the 43rd annual convocation of AIIMS in New Delhi.
It has to support and encourage the institution while not getting into the micromanagement of the institution. And I must say, to the credit of the present Health Minister, his predecessor Dr. Harshvardhan and Dr. Harshvardhan's predecessor Shri Ghulam Nabi Azad, at least three of them deviated from the past practice and of not getting involved in the micromanagement of the AIIMS and left it to the professionals in the institution to allow it to grow and flourish. And that is probably what made that break from the past made your job a lot easier. I remember at that time when I was in the legal profession, I had to occasionally associate myself with the problems of the institution, particularly when the excessive involvement took place, which was probably not in the larger interest of the institution itself. The institution has many great challenges. It has challenges because, as I said, patients all over the country look at you. You are also a nursery for providing talent to various hospitals in the country. A very large number of private healthcare institutions in India are today manned by your alumni. And therefore, in that sense, you are a great nursery of medical talent. And this institution therefore has to expand. I've been in touch with the director and the Honorable Health Minister. Of course, within this present premises where we are, there is a limited scope for expansion. We've been discussing the vision of having residences shifted somewhere else, maybe close by, and the campus being used essentially for healthcare facilities. The trauma center, the land next to the trauma center, the residential area at Arya Vigyan Nagar, the other campus that you wish to develop in Masjid mode, the Jhajjar campus which is now developing, are very important institutions. And I am one of those who believes that ingratitude is a political sin. And therefore I remember when I was a few months ago here in my capacity as a patient, Dr. Mishra and I were discussing this. And that is when this whole vision of expanding the utility of the existing campus, I think, first came up in our discussions. There are proposals being discussed between the Health Ministry and the Department of Expenditure. I can assure you that within the constraints of budgetary allocation, we will certainly do the utmost that we can in order to support these expansions. And the reason is very simple. There is one great positive development which has taken place, which is development of good and excellent private healthcare institutions in India also. In the absence of an adequate insurance backup and the cost involved, it's only a limited section of population which can go for treatment there. And therefore, institutions of this kind in the public healthcare system need to be encouraged and nourished. And that is one of the reasons, despite the initial difficulty of availability of adequate faculty available, which I am sure in due course will get available, this whole idea of having similar institutions in other parts of the country have been coming up. It's a challenging job, but it's a job which there is no option or alternative to it. And therefore, expanding on the existing resource that we have in Delhi, I think is a great idea. And it's an idea which requires to be expanded for all.
That was